about COVID. First off, there are so many terms and fancy words that you want us to know, like mitigation. Can you talk about those and define a couple of them?
Yeah, so mitigation is just the process of reducing risk in this case for spreading COVID-19 on our campus. When you're talking about like the risk mitigation plan that we submitted to the city, that's exactly what it is. All the steps we can take to reduce the chance of getting COVID on our campus.
Okay, can you define just a couple other terms then?
So let's start with contact tracing. So that's going to be huge when we talk about COVID on our campus this year. Contact tracing is used by local health departments to help stop that spread. So we know that the COVID virus can spread through person-to-person contact. So trying to figure out who was in close contact with someone, and that's less than 6 feet for more than 15 minutes. That's what defines close contact. So if you're within that range, you would be considered a close contact if someone tested positive.
All right, so let's say hypothetically, I go off campus like a get together and we're doing things that are against WLC policy and end up getting COVID. Will you ask me who I all came in close contact with and like, will I get in trouble? Will they get in trouble?
It's a really good question. Here's how I'm going to answer that. We do need students to be absolutely honest about who they are in close contact with, because that will reduce the spread on our campus. The great news is it's usually done by the health department or by health services, and both of us operate under confidentiality.
Awesome. All right, so then if I get COVID, I'm gonna have to isolate. Can you just kind of explain what that means and how it's different from quarantining?
Yeah, that's a great question. So quarantine is for students who are potentially ill or who were in close contact with someone. So they haven't tested positive or they don't have symptoms at this point. We may ask a student to quarantine if they have some symptoms, but we're not totally sure if it's COVID or something else, because it does look very similar.
Okay.
But isolation means you've tested positive for that virus, or you have enough of the symptoms that our medical staff is making a best guess, waiting for that result, that you probably have it. So quarantine, you would separate yourself. For the most part, you wouldn't go to class, you'd wear a mask at all times, try to keep yourself separate from most people. You can go out and pick up your food, get your medication, go take a walk, just make sure you're always wearing a mask. But in isolation, because you already have that virus, you are like removed from the community at that point until that virus kind of runs its course and you're no longer contagious. So that is about 10 days. Plus 24 hours of no fever,
okay,
and 24 hours of improving symptoms. So for the most part, it's around 10 days, but some could go longer. And we want that to be separate so that way, first of all, you can be healthy. You're sick at this point, whether you're symptomatic or asymptomatic. That's another term, right? Symptomatic, you have those symptoms. Asymptomatic, you're carrying the virus, but you're not feeling any symptoms.
Okay.
But because you're carrying it, you can spread it.
Yeah.
And that's why we want it to be separate.
All right, so then when you're isolated, we have to go home. Can you just kind of explain like why we have to go home and spread it to more people? Or like what the difference is from staying on campus?
Absolutely. So because quarantine, you're not testing positive for that virus at this point. We're just taking extra precautions in case you would have that virus.
Okay.
We're allowing students to quarantine on campus. Typically within the room, our health department will guide what they say is okay or not okay.
All right.
And it's really dependent upon what your housing looks like.
Mm-hmm.
So it's going to be very case by case. We'll work with you and the health department on that. But with isolation, because again, we want you removed from the community, and because you are considered ill, whether you're symptomatic or asymptomatic, 2 reasons. One, we need someone to make sure they're taking care of you. Mm-hmm. And so by going home, we know that you're probably safer there. And if we're on campus, we have procedures in place to continue to check on students, because there will be students who can't go home.
Okay.
The reason we ask students who are within that 3-hour radius to isolate at home is because we really don't have the space on campus. This is our largest class coming in, and our record number for resident students as well.
Okay.
So we don't have the space to have everyone isolate on campus either.
All right, that makes more sense. Thank you.
Mm-hmm.
So then if I have to see the nurse about a non-COVID related like situation, am I still able to do that?
Absolutely. We are here for all things medical and mental health. So if you have another illness or a cut, a scrape, a sprain, whatever it might be, please come utilize health services. We are saying that all non-urgent medical or mental health needs should make an appointment.
Okay.
And the reason for that is because we are going to have likely other students in here who maybe have carried that virus. So we want to make sure we are timing out our appointments. We have enough time to clean.
Yeah.
You know, people aren't waiting in the waiting room. We're just trying to, again, mitigate that spread of that virus.
That makes sense. All right, so then my last question is about this Warriors Together thing that I've been hearing about. Can you just kind of explain that to me?
Sure. Warriors Together, it was a collaborative idea through student programming and marketing, health services, as a way to try to encompass what we need students to do to, again, mitigate that risk of COVID-19. So there are 4 things we're going to ask all students to do at all times. The first one is to always wear your mask.
Okay.
So if you are in a public place or if you are outdoors and you cannot maintain physical distance, we need to be wearing that mask.
Okay.
If you are in your residence alone with just you and your roommate or roommates, you don't have to wear your mask. But if you are in your private residence and you have guests over, you will still need to wear that mask.
Okay.
So we encourage students to use outdoor spaces, use common areas versus, your own space. It's smaller in your dorm rooms or in your apartments. The second thing we want all students to do, and we're asking them to actually make a commitment about this, is to keep that physical distance. 6 feet. 6 feet is pretty much the standard right now, because when they're doing the testing through the droplets that are being spread, 6 feet seems to be a good distance where it's not as able to spread from person to person. The third one is clean up. So clean and disinfect your residence regularly. That is going to help. As well as any common areas. If you are, in the loo or whatever and you're eating, then clean it up.
Yeah.
Right? And then the last one would be to check in. So every day we want students to just do a self-check. How am I feeling today? Do I feel normal or is something feeling off? We aren't saying you have to track it on an app at this point. You are welcome to download an app if you would like to help keep yourself accountable with checking those symptoms.
Okay.
But just know how you're feeling, and if you're feeling not quite right, call health services, and we will talk to you over the phone or send us an email, and we'll give you a call or an email back.
Okay.
So that we can help figure out kind of the next steps. What does this look like for you? Do we rest for a day or two, or are you coming in right away for an appointment? Do you need a test? Should we wait for a test? And our medical staff is trained, and our student workers will also be helping with some of those phone calls.
Awesome.
So again, it goes back to that appointment, so we know how best to serve you.
Yeah. Awesome. Well, that's all I have for you, and thank you.
You're very welcome. Thanks, Hannah.